maybe the cloud. All right, well, thank you all for joining us with Empathetic Healthcare. My name is Nina Walker. I'm an athletic trainer at the University of North Carolina at Chapel Hill. I am currently the Public Relations Chair for the North Carolina Athletic Trainers Association, and I'm also a member of the Diversity, Equity, Inclusion Committee. And so one of the reasons why we felt like this would be a really great topic to do is because as healthcare workers, it's really important for us to understand and be compassionate with the patients that we serve. And there are a lot of factors that even myself, I didn't even realize. And so as we started investigating a little bit more, it's been really helpful for me personally, and I think it will be for all of us, just to kind of talk through, some of the things that we encounter, as athletic trainers in the event of like cultural compassion and stuff like that. Kelly?
So I'm Kelly Daniels. I'm also an athletic trainer at Duke Orthopedics, and I have my master's in mental health counseling, and I'm a nationally certified counselor. So that's why Nina and I got together to work on this for everybody.
Awesome. I'll go next slide.
I'm trying to, there we go, okay. All right, so just a quick blurb. The intention of today is to foster discussion among ourselves as professionals, but also to foster self-reflection. When you leave this talk, hopefully some things are brought up that you do want to think about more and explore more in order to be a better healthcare provider. So it's not that today is meant to be an exhaustive list of every identity that we may see in patients and how to work with them. That's just, as wonderful as that would be impossible to do in a appropriate amount of time so that we can all move on with our day. So instead, we really just want to focus on the discussion piece and digging deep and self-reflecting on our reactions to a lot of stuff we'll talk about today.
And so, I think one of the things that we have to think about is like, why is this important? And as we know, in the past, it was always an ankle's an ankle, I treat an ankle sprain the same. But as we're evolving, as a culture and a community, we're recognizing that, athletes and injuries are more than just the body part. It's a more holistic type of, medicine. And so the recognition that each encounter that you have with a patient could change the outcome and it can change, their progress. I think we can all think about times in our lives where we have had really, really great healthcare providers and our outcome has been better because we've felt heard, we felt considered, and they really thought about us as a whole person as opposed to just the body part. And so I think that's why it's really important for us to recognize, that we are different and that there are things that will make our treatments better based on a healthcare provider that understands that.
The other part of this that I wanted to bring up is that as healthcare providers, we are in such a position of trust with our patients, whether it's in the clinic and we have that inherent trust in the fact they came to a doctor's office that day, or the athletes that we build relationships with in other settings. And that with trust is power and is privilege. So we need to be able to respect the power that we have in our influence with our patients and athletes, and also the fact that they trust us and are coming to us is a privilege that we have, and being able to understand how we act towards them is going to impact them, given the fact that we have this trust and power. And just to bring, this is just one example with one kind of specific community, but the Trevor Project does a lot of really great research in this 2019 survey that a youth going through a gender identity issue, if they have one accepting adult in their life, they're 40% less likely to attempt suicide, which is just staggering. And what is really important about that too is that they also controlled for other things like age and gender identity and race and ethnicity. So it's not that 40% really held across a lot of other categories as well. And that's just something to think about, not just with this population, but every population, that as healthcare providers, we have an opportunity to either support a person and be a positive experience, or we have the opportunity in a negative way to participate in a system of oppression and marginalization for that person. So we're either participating in it, or we're choosing not to participate by going another direction. So just thinking about that in our interactions with our patients. And if you are demonstrating empathy, or you're demonstrating that you're trying to understand, or even that you have shared experiences, patients are more likely to be able to relate to you. And in a lot of cases, that's going to improve their healthcare and outcome, like Nina was just talking about. So something that I just want to spend a second defining as we enter this discussion is, what's the difference between sympathy and empathy? So sympathy is acknowledging another person's pain, emotions, experience, whatever it may be, and expressing sorrow. So like classic, like, oh, that sucks, I'm so sorry, or I feel so bad for you, or those kind of statements. That's sympathy. Where empathy is making the effort to understand, whether that is because you do have a similar experience, or just that you're putting in a cognitive effort to listen and to imagine what it would be like if you were in their shoes, and to accept that what they're saying is reality. So just focusing on the empathy today, obviously. That's a little cartoon. So I like this cartoon. I'm interested to see if anybody kind of has reactions when you're looking at this. Like, what do you notice that's different between these two? Anybody have some thoughts?
And you don't have to raise your hand. Just
You don't have to raise your
shout it
hand.
out.
Tears in his eyes. Looks like he's gonna give him a hug.
Which is interesting that you say that, because his arms are in the same position in both, right? Like, it's not physically any different, but we're reading that body expression differently because of the tears in his eyes. So what does kind of that tell us that's different in the second situation?
I'm sorry, I'm gonna jump in real quick. I apologize, my camera's not on, but I'm still fighting two kids at the house. Not physically fighting, just dealing with. And speaking about the tears, the one thing that jumped out to me is that the tears of the person supplying empathy in the second photo are not as large as the tears as the person going through the emotion. And to me, that helps signify that in showing empathy, you're attempting to feel what they're feeling, but oftentimes you're not able to feel it at the same level. But even in making the effort to attempt to feel and understand what it is they're going through, again, you're trying to show empathy in that situation. But oftentimes, even being empathetic, you're not able to experience the pain or discomfort at the level that the patient or the person is experiencing it.
Yeah, that's awesome. No, thank you for sharing that, because that makes me think about how we use the word like empathy to understand, and it's, well, how much understanding can we do, right? Like, we didn't live their experience, so we can try to understand, we can make the effort to understand, but everybody's experiences are still their own, and they are the only person that lived them, and respecting that as well. So thank you for that.
Yeah, and I know we're talking about the empathetic side, but I think as I was learning a little bit more about the difference between sympathy and empathy, for my whole life, I thought a sympathetic response was what I wanted to deliver, because I think in healthcare, sometimes we feel like we have to have this like very strict boundary, and it's their experience, it's what they're going through. Like, I can't be sad for every single person that, comes into my space. But, listening to Brene Brown and really talking about vulnerability and learning about, sympathy, and how it really pushes you away from the person that is having that experience, by almost putting yourself on a different level than them. Well, that sucks for you, but I'm good, and so I thought that was interesting paradigm shift for me personally, and that sympathy was what I thought I wanted to do. But then learning more about empathy is what I actually need to do in order to help my patients realize that, I can, feel for them and understand, not feel everything, but understand some of their experiences.
Yeah. And I am going to pick on you for a second, because you just said that. If instead of saying then, like, this guy's saying, I'm sorry, that sucks, what would you say instead that would be an empathetic response?
I think a lot of it's more like, thank you for sharing that with me. I really appreciate you letting me know how you're feeling, and, just sitting with them in whatever that feeling is.
Yeah. another thing that I think about too, so one, like validating that they went through that and appreciating that they trust you enough to share that.
Mhm.
And then the other thing I think about is like reflection. So if they're saying like, I'm like so stressed about this is horrible, this is like whatever it may be, just being able to reflect that back and like, that sounds so frustrating. That seems like, whatever emotional word that you can reflect back. And that you don't need to solve their problem or tell them that, I totally get it. I've been through that too. Like, that's not what they need, but being able to be like, I hear you. And I hear that you're expressing this particular experience or emotion or whatever it may be. Any other thoughts on stuff that you would say back to someone instead of the I'm sorry, that sucks response?
Yeah, Q has, I hear you.
Always a good one.
Mhm.
Nice to be heard.
Tell me more from Jewel.
Mhm. Okay, moving on.
So I'm going to quickly go through this, but I thought this was a really awesome visual about power and privilege and what our patients may be, because I think, sometimes we forget, especially as athletic trainers, we always think we're the lowest on the totem pole, but our education, our knowledge, our, neurotypicalness, or, a lot of things about us, whether we're American citizens, like things like that will put us on a different level in terms of power and privilege with our patients. And I think it's really important that we acknowledge that there are a lot of different things, a lot of times, sometimes we get stuck in the racial or the gender power and privilege, but things like, are you able-bodied? Most of our patients have some level of disability that we are not experiencing, and we are able-bodied, or our education or citizenship or the ability to speak, the English language. These are all things that, give us a little bit of power. And so recognizing when you're dealing with patients that may be on a different part of the power and privilege wheel. And once again, we all can exist on multiple different parts of this wheel, to just take some pause and recognize, what does this person need to make our interaction, more successful. And so I just thought that this was a great visual. Sylvia Ducksworth has it. And so I just wanted to share that with everyone while you take a second to just like review some of the different things, even housing, those are things that, sometimes we don't think about for our patients. And that has a lot to do with how we are going to rehabilitate someone and what they're going to be able to experience. And so, so just thinking about, some of the things that we have power with, and some of the things that, some of our patients may be leaning more towards the marginalized part of.
I also like this visual because it's a little more all-encompassing. So thinking about things that we don't always think about, the language one jumps out to me a lot, being in a clinic setting myself. So that's one that kind of jumps out to me that, I could spend more time thinking about. Or citizenship is another one that I probably could spend more time being aware of in clinic that maybe I'm not. So just kind of using this to reflect on what are some things that I don't really think about as I'm going through the clinic flow or through the motions of the day. And also just thinking about that it takes effort to understand people that are different from us. We can, we can put in that effort to try to learn, but it does take effort, being intentional with that effort.
So as Kelly and I were talking through some of the things, we thought of 3 C's of empathetic care, and we felt like these were 3 things that we can do consistently that would make our care of our patients, better. The first one is compassion. I don't think there's anything that's more loving than listening to your patients and learning about them as a whole person. And one part of compassion is placing aside our beliefs and values to accept our patients fully and without judgment. And we'll go through some cases and things like that, but sometimes that can be really hard because our value system is our value system, and some of us hold it really tightly. But being able to listen empathetically, feeling your internal cues, like if it feels uncomfortable to you, it's probably uncomfortable for them. So demonstrating compassion with, your patients. The other thing is consistency. And I think this is a thing that makes it easier. If you create a muscle memory by asking each new patient the same thing, then it really creates a situation where that it's not unusual. If you ask about what their preferred name is or how they'd like to be addressed, what pronouns, do they use? What could you use? I always ask, what could I know about you to give you the best care? And so just asking someone that really opens it up so that they have the ability to tell me what's important to them and what's valuable to them. And those are questions that I ask all the time. So if one patient hears me say to another patient, then it's not unusual, for them. And so really trying to find something that's consistent so that you can really get to know your patients. And then collaboration, working together to incorporate their cultural considerations into their treatment plans. So one thing that I'll always say is, okay, so this is the plan that I've set up. Are there any barriers that you see to successfully completing it? And I think that that's a really powerful thing because, even the other day, I asked one of my patients, I just assumed that she would be able to access ICE and everything like that. And she said, you know what, I don't have ICE, is there anything else that I could use or do in order to accomplish that? And then we had a conversation about different options. And so having them look at the plan, having them talk about the plan with you, and then seeing if there are any barriers. The other thing was, how do you learn best? Sometimes we forget that not everybody receives information the same way. Some of our patients have some neurodiversity. And so asking them, is this piece of paper good? Do you need me to have pictures? Are videos good? Now that we have Instagram and all these other video encounters. And so really being collaborative with your patients and taking into consideration some of their culture in terms of what they need. I have one story where I had a patient who had, she was of Asian descent, and her mom, after an ACL, put this balm on, and the next day she was very red and swollen. And so, I could have just dismissed it and said, like, listen, you can never do that again. Like, that is not appropriate. But what I did is I talked to her a little bit about what was in the balm, what, why do you think that your skin is so red? What do you think, happened? And she was like, oh, well, this was the stuff that we made. And it essentially is like a tiger balm, but with herbs. And I said, well, that, is going to be really good for later in your treatments. But right now, I explained to her why it may not be the best. And so she wasn't dismissed. I didn't dismiss her cultural treatment, but I did help her give some perspective in terms of what would be appropriate for that time. And the last thing is always our favorite, which is documentation. And I think it's really vital to be, consistent with our consideration of pronouns and cultural considerations for our future providers. And so a lot of times, if you have notes, particularly in the clinic area, if you can do the work the first time and just put in what the person's preferred pronouns are, if there are any cultural considerations that you had to make for the patient, if there's any things like housing issues or access issues or anything like that, then the next provider can actually get that information as well. And the patient doesn't have to constantly relive, whatever they are, whatever's going on. Also, forms are the front doors to our values. If we take a look at our forms, and what questions they're asking, it gives the patient a big understanding of what kind of care they're going to receive. And so asking on the forms, like what their preferred pronouns are, making sure that we have maybe an open-ended gender question as opposed to a binary gender question, asking them, different questions about things that, may help you provide better healthcare. And so those are the 3 C's, as well as documentation, that, like we've thought of as ways to just be like consistent in our healthcare.
Yeah, and the documentation, the forms, while you were talking, I was just thinking about the open-ended question more, because we don't know what we don't know. So if I'm giving you a closed-ended question of choices, I could be missing out on a lot of things that a patient might want to tell me if I asked it in a different way, but I didn't know to ask it that way to prompt that response from them. So being as open-ended as we can be to give them the opportunity to share with us what they want without feeling like they're given this set of 2, 3 choices, whatever it is, and that's what they have to pick from. And documentation, I love phrasing documentation as an opportunity to like promote and protect our patients, because it really is. If I can document accurately what that patient's preferences are, what their pronouns are, like whoever they are, then I am putting the onus on the next provider to see that and be like, okay, now I'm going to make the choice to also treat this patient competently and appropriately. So being able to just to put that on the next provider and also give them the tools to be the best. And if they're not the best, well, you did your best to protect that patient. It's another kind of extenuation from compassion, talking about putting our values and beliefs aside. I do think it's important just to bring up that we all have biases, that it's completely normal that we all have biases. We learn them across our whole lives in a variety of ways. But when we work in healthcare and we have this position with patients, we are responsible for working past those and not letting that impact our work with our patients. So just talking about bias versus implicit bias. Bias is that kind of obvious, I have a prejudice against one thing, person, group, that I think this one thing, whatever it is better than this other thing. Those are your obvious ones, but your implicit bias in the healthcare setting are the ones that we really want to dig into, because those are the things that we don't know that we think maybe, or that maybe this stuff comes up in our head, but we push it aside because it's like not that big of a deal. It doesn't really impact our day, but it does. It seeps into every interaction you have. It seeps into the choices that you make. So our implicit bias are more those attitudes or what we associate, the connotations that we have, the automatic thoughts that pop into our head when someone walks into a room. Those represent our implicit bias. So when we were talking earlier about our internal cues, really taking a second to listen to what just pops into your head unbidden, and thinking about, okay, what is that telling me that I have like deeply down here that I need to think about before I make decisions in regard to this patient? We have to recognize those biases in order to put them aside. I can't put aside a bias or work through it or make sure that I'm protecting this patient from whatever my thought is if I'm not listening to it. Then I'm just probably going to transgress it towards my patient. So recognizing that implicit bias takes a lot of work. It's a lot of self-awareness. It's a lot of like listening to the thoughts in your head and then sitting there and thinking, why did I just think that? What does that mean? What's going on in my head? And that requires educating yourself, but it also requires practice of working through it, which is something that we're going to include today. And this is just my quick plug for this book that I really love. It's sitting over there, but this is a book by Dr. Eberhardt, who is a researcher over at Stanford. I recommend this to a lot of athletic trainers and medical providers that spend a lot of our lives looking at data, because it is very data driven. She does a ton of studies looking at how bias, implicit and explicit, impacts the systems that we live in. And there's a lot of data in it. And as we all know, it's harder to argue with data than it is to argue with emotions for whatever reason. So if you're looking for something to dig into, that's my quick plug for Dr. Eberhardt.
And then the other thing that we just wanted to alert you to was that the NATA has a lot of resources to help you make sure that your environment is inclusive as possible in the athletic training spaces that you have, as well as with specific, communities. And so they've really tried to increase their cultural competence in terms of a lot of different cultural, scenarios. And so this is one that the NATA has adapted from GLSEN, and it just really gives you just some really easy, objective ways to make sure that you are creating an inclusive environment in your space. And the more that you can do that, the more people are going to feel comfortable really being vulnerable and helping you understand some of the things that can make things better for them. And so I just wanted to let you know that the NATA did have some policies, did have some suggestions. We're working with agencies to really help us as healthcare professionals treat everyone well, not only in their injuries, but with empathetic healthcare.
Okay. Nina, do you want to stop recording?
Yes.
Thank you.